Hello, my name is Nicole Gilbert. I'm a registered dietitian at the Alberta Children's Hospital Pediatric Intensive Care Unit and a master's student in epidemiology at the University of Calgary. I am presenting my research proposal, Does Volume-Based Enteral Feeding Improve Nutrient Delivery in Critically Ill Children? A randomized control trial of enteral nutrition algorithms. My research will look at the impact of using a novel tube feeding approach to improve nutrient delivery and outcomes in critically ill children. Early and optimal enteral nutrition improves clinical outcomes in children admitted to pediatric intensive care units. Unfortunately, feed interruptions are common, which can result in underfeeding and cumulative nutrient deficits. Traditionally in pediatrics, tube feedings are provided using an hourly rate-based enteral feeding algorithm. The problem with this approach is that feeds are not adjusted to compensate for interruptions. A volume-based enteral nutrition goal may circumvent this issue by allowing the bedside nurses to adjust feeds to deliver the 24-hour feeding goal and compensate for feed disruptions. Research conducted in adult critical care looking at volume-based enteral feeding algorithms have shown improved energy and protein delivery. However, as far as we are aware, there are no pediatric studies that have compared volume to rate-based enteral feeds. So the aim of my study is to determine if a volume-based enteral feeding algorithm will improve critically ill children's nutrient delivery and their recovery. Our primary objective is to compare energy adequacy during PICU admission between critically ill children fed using a volume versus a rate-based tube feeding algorithm. As well, we will examine the impact of volume-based tube feeding on protein adequacy, changes in growth measurements at transitions of care, feed tolerance, days on the ventilator, mortality, and length of stay in both the PICU and the hospital. We will conduct a randomized control trial of children admitted to the Alberta Children's Hospital Pediatric Intensive Care Unit who require tube feedings. Children will be randomly assigned to either the intervention arm, which is our volume-based feeding algorithm, or the comparison arm, which is our standard of care rate-based feeding algorithm. We will compare energy and protein received between the two groups. And we will also look to see if children fed using the volume-based tube feed algorithm have better recovery. Our proposed study will provide evidence on whether this novel approach to feeding critically ill children improves nutritional adequacy during PICU admission and influences clinical outcomes for children and their families. Thank you to the Aspen Rhodes Research Foundation donors for this opportunity.